Hello, Miss Hilo. I'm Drake. I'm your nurse today. I just got a note that your wound dressing hasn't been changed in about 6 hours, and doctors know that dressing should be changed about every 6 hours. So we're gonna be doing that real quick today, okay? Before I start, can you verify your name and date of birth for me? Okay. And are you allergic to anything? No. And are you experiencing any pain right now? No? All right, cool. So before I start doing your dressing, I'm gonna go ahead and set my table up real quick, okay? Alrighty. So for my sterile field, before I even open up the wound care tray, I'm gonna look for expiration and integrity of all the contents inside, make sure everything's intact. And once I do that, I can go ahead and peel our tray open away from me like this. Grab our gloves, open the packaging up, making sure that the arrow faces towards me. Gonna open it up, making sure not to touch the inside of the package. Now I'm gonna start with my dominant hand, and then I'm gonna use my left hand to hold on to the cuff, like this. I'm gonna go ahead, put on the gloves, making sure my hand is not crossing our sterile field. Once I got my right glove on, I'm gonna go ahead and use my 4 fingers, put them in the pocket right here, making sure my thumb is out of the way. I'm gonna slide our first 4 fingers in real quick, and then tuck our thumb in, trying to feed our fingers in. These gloves are a little stubborn, so I'm gonna use sterile to sterile, sterile to sterile, just making sure that the gloves fit nice on my hand. Once I got my gloves on, I'm gonna go ahead and grab our sterile pad right here. I'm gonna back away from the table. I'm gonna unfold it, making sure not to touch me or the table to make it unsterile. Once it's unfolded, I can go ahead, fan it away from me, and drop it. And now from here, I can take out all of our contents within our wound care tray. I'm gonna make sure to keep my hands up. All right. Now that I got all the items out, I'm gonna grab our biohazardous bag. I'm gonna unfold it, unravel it here. I'm gonna make a little fold since this will be our waste bag for all of our gauze and for our dressings coming up here. Place this at the foot of the bed. Okay. And now that I got the bag at the foot of the bed, I can go ahead and take off Miss Hollow's top dressing right here. Miss Hollow, I'm gonna go ahead and take off your top dressing. If you feel any pain, let me know, okay? Make sure to undo the tape nice and easy. Not wanting to cause any irritation of the skin. And once I take the top dressing off, I'm gonna note the color, the amount, and if there's any odor associated with the top dressing, I'd make sure to chart that down. And I can go ahead and dispose of this away. And I'm gonna do the same thing with the inner gauze. I'm gonna take these out. Miss Hollow, I'm gonna take your gauze out real quick here. Again, let me know if there's any pain. And since this gauze is being a little stubborn, I can go ahead and take our normal saline after I dispose of this real quick. I can fill our cap up. And then I would go ahead and put a little bit on the gauze just to loosen it up. just so we're not tugging at that skin too hard. And then we can go ahead and lightly take this off. Again, noting the color, the odor, the amount of discharge present. And now we got Miss Hollow's wound exposed to us. I'm gonna know the color of it, making sure it's like a reddish pink color to signify that it's healing. If we see any like blackness or purpleness, any necrotic tissue, that would definitely set off a red alarm and we need to investigate further. But right here, I can now go ahead and take out our ruler. I'm going to measure Miss Hollow's wound in centimeters, making sure not to have the ruler touch her, just kind of approximate it out. And it's about 4 centimeters long by 2 centimeters in width. I go ahead and chart that down. And now that we measured the wound, we can go ahead and start cleaning it. So I'm going to grab our gauze right here. I'm going to crinkle it up a little bit. Dip it in the saline, kind of wring it out, make sure it's not too saturated. I'm gonna go ahead clean from clean to dirty, nice and gentle. Miss Hollow, let me know if you feel any pain, okay? While I do this. Go ahead and dispose of it. Do it one more time. Miss Hollow, ready? Okay. Now that we clean the wound, we can go ahead and pack the dressing back up. Again, we're going to go ahead and use our gauze that we have. Dip them in the saline again. Kind of ball it up and then fluff it out just a little bit. So I'm going to insert these into the wound, okay? Let me know if you feel any pain. Making sure to be not too abrasive. Just being nice and gentle. And once I pack the wound, I don't have any more of the 4x4 gauze, but what I would do is I'd put 2 on top to kind of on top of it, just to secure the dressing. And then once I have the 2 4x4 gauze on top, I can go ahead and use our ABD pad right here. Noting that the blue line signifies the sky. So this part's gonna be the outside portion, this part's gonna be the inside. So I'm gonna go ahead and lightly put that on. Miss Hollow right here. At this point, I can take my gloves off. And then we're gonna tape it up like a windowsill, corner to corner, corner to corner, and then corner to corner. And I'm just kind of approximating the tape out. We don't want to tape, rip the tape out right over Miss Hollow. Go ahead and tape this on. Being nice and gentle again. Once we have the ABD pad on top, I would then go ahead, since I already used my label, I don't have any more labels, but I would grab a label, I would initial it, time it, and then date it, put it on the corner of the ABD pad, so when future nurses come in, they can be like, okay, Drake, change Miss Hollow's dressing at this day, at this time. And then I would put it right at the corner. And then once I'm done with that, I would go ahead and dispose of our biohazardous bag in a biohazardous container, making sure not to mix it with any of the normal bags. And then we're complete. Miss Hollow, you feel okay? Feeling any pain? No? Well, if you need any Tylenol, any pain medication, let me know, okay? I'm here for a few more hours. I got your call light right next to you, okay? Just let me know, okay?